Excellencies, distinguished guests, dear colleagues and friends, thank you for your presence here today, for your continued commitment and support to the Defeat NCD partnership. This year, our session is focused on action, on commitments realized, on guidance applied, on words being translated into action. We have a rich program for today, starting with a keynote address by one of the earliest supporters and thought leaders who has been guiding and supporting the Defeat NCD partnership since its inception, really, and making sure that its strategy and focus is on practical action complementary to the norms and standards of the World Health Organization. Dr. Tedros, Director General of the World Health Organization. This will be followed by a high-level panel discussion with our esteemed speakers and figures in the global health fight against non-communicable diseases. And last but not least, we'll conclude the session with providing research grant awards to youth researchers who are embarking on journeys to advance implementation research for multi-sectoral action on NCDs. I'm aware of the fact that Dr. Tedros is in high demand for the different sessions of the World Health Summit, and I'm very thankful that you took the time to join our session today. So without further ado, please allow me to invite you to the podium to open up our session with your keynote address. Ladies and gentlemen, Dr. Tedros.
Thank you, Mukul. I was wondering who you wanted to give your seat to. Okay. Minister Al-Kuwari, Minister Mandavia, Excellencies, dear colleagues and friends, I thank UNITAR and the Defeat NCD partnership for co-hosting this event with WHO. You're all familiar with the statistics that every year NCDs kill 17 million people under the age of 70, which is 1 every 2 seconds. What is less known is the fact that NCDs account for 85% of premature deaths in low and middle income countries. The health consequences are bad enough. The financial consequences can be devastating. Every year, millions of people who live in poverty are exposed to severe financial hardship as a result of out-of-pocket costs to manage NCDs. Families are faced with decisions that no family should ever be, like whether to buy food or medicine. Many choose to forego treatment because they simply cannot afford it. And yet, we know we can prevent NCDs, the suffering they cause and the costs they incur, by reducing exposure to risk factors and by improving access to services for prevention, diagnosis, and treatment. The Sustainable Development Goals set a target of reducing premature deaths from NCDs by 1/3 by 2030. But on current trends, we will not reach that target. That's why we have called this session From Words to Action. It's time to step up. At the UN General Assembly last month, WHO co-hosted the first meeting of the Heads of State Group to discuss the Global NCD Compact. WHO is committed to supporting countries to address NCDs with evidence-based policies backed by timely and reliable data. However, far too many people around the world lack access to these life-saving medicines and interventions, especially in the lowest income countries. Today, we're discussing several efforts to address these severe inequities. One important contribution is the Defeat NCD Partnership's Essential Supplies and Distribution Facility, which aims to improve the availability and affordability of medicines, diagnostics, and devices. The partnership has also supported countries, including Rwanda and Gambia, to develop, fund, and implement national posted action plans, and together with WHO to support young researchers. Like any other area of health, research is essential if we are to make progress. That's why in WHO, we have established a WHO Technical Advisory Group on NCDs innovation and research, which will focus on implementation research and on building capacity in research. Investing in the next generation of public health leaders and researchers in lower income countries will help close the knowledge to action gap and improve the uptake of proven NCD interventions. That's why WHO, the Defeat NCDs Partnership, and the Alliance of Health Policy and Systems Research have launched an NCD implementation research grant program for younger researchers from low and lower middle income countries. Today, we're pleased to present 8 finalists whose research effort will make a difference. Please join me in congratulating these young leaders. And before I close, I would like to thank Mukul, my friend, for his leadership, and also remembering Mukesh Kapila for his leadership. Thank you so much. I hope he's not able to join us, but he should know that we remember his leadership and his pioneer work. Thank you so much. Thank you.
Dr. Tedros, thank you for that introduction. Can I also say how good it is to see everyone a year on from the last Berlin World Health Summit? My name's Juliet Foster, and I will be really taking you through what I guarantee will be a very packed afternoon with analysis and also celebration of the many achievements which will be happening in the future. But let's go back to last year, because at the time, COVID-19 was still a conversational fixture as nations began to ease their way out of the lockdown towards a thing called normality. Yet as the world embraced the prospect of a life without COVID, I should say, for a very large swathe of the global population, non-communicable diseases continued to exact a chilling toll. You had a hint of that from Dr. Tedros, but just to broaden things out numerically, we know that 41 million people die from NCDs each year, and that the deeper you dig, the more horrifying the statistics, all of which begs the question, why are these deaths occurring when cost-effective evidence-based interventions that prevent and control NCDs already exist? Well, in trying to answer that question, there is so much to consider, including, of course, the rising cost of medicines, the presence of substandard drugs in supply chains, a lack of regulatory harmonization, and the challenge of ensuring that medicines are not only available, but are also used appropriately. And let's also not forget that NCDs often form a malicious nexus of comorbidities with other chronic conditions. So the answer to reaching the number of NCD or reducing the number of NCD-related mortalities actually lies in building national capacities that can provide quality and long-term care in the prevention and treatment of non-communicable diseases. Now, innovation and good practice are essential, especially as many low and middle income countries are unlikely to achieve the UN Sustainable Development Goal 3.4, which aims to reduce NCD deaths by a third by 2030. We're not too far away from that deadline. Let me draw your attention to a study carried out by The Lancet this year, which claims that achieving that goal worldwide would require $140 billion in new spending in the 2023 to 2030 period, resulting in an annual average spend of $18 billion, leading to the avoidance of 39 million deaths, while generating net economic benefits of $2.7 trillion. It's fair to say the numbers speak for themselves. So today we're going to hear from a distinguished panel of experts, including the Health Minister of India and also the Director of Public Health of the Ministry of Public Health Qatar, who'll discuss the steps they're taking to combat NCDs in their respective countries. We're also going to hear from Boehringer Ingelheim and the Helmsley Charitable Trust, who work with the Defeat NCD Partnership to grow the vision of universal health coverage for non-communicable diseases. Just to contextualize things, the aim of this event is to turn words into action by ensuring that what happens today will lead to lasting achievements tomorrow. That is why later in this session, we're going to be awarding grants to 8 researchers in recognition for their work in fighting NCDs and improving mental health as well. So with that in mind, I want to open the panel with the first of our distinguished speakers. Dr. Bente Mikkelsen is Director Non-Communicable Diseases in the Division of UHC Communicable and Non-Communicable Diseases at the World Health Organization. Dr. Mikkelsen, it's very good to see you. The floor is yours. But before you start, can I remind you that you have 5 minutes, and I will alert you when you are 3 minutes into your presentation. I'm feeling that ruthless. The floor is yours.
I'm sure, and thank you very much. Time is precious, especially for NCDs. So excellencies, friends, and ladies and gentlemen and friends of NCD, I would say. So today's intervention, which we will all enjoy, I'm sure we enjoyed, DG Dr. Tedros, will emphasize the reality of our challenges. You mentioned them in figures. What has not been emphasized so much is the need for integration of non-communicable diseases into universal health coverage. That is the way to make it sustainable. And that means, of course, access to healthcare, to medicines, devices, but also to health workforce. So we have seen some data lately, and if we look at the country capacity survey, we see that only 69% of member states have some sort of NCD included into UHC. And if we look at the UHC monitor, we also see that we are lagging behind on NCD, while maternal and child health infectious diseases has really made it to the mark. Another thing, and Dr. Tedros mentioned it already, was what was disclosed during COVID. We saw 50 to 60% disruption for cancer, for diabetes, for chronic respiratory diseases, and also for diabetes. And this is really a deadly interplay. We saw people dying, we see excess mortality, but we also see a big backlog now hampering every country. So all of this is important, and we know that if we are going to achieve the SDG 3.4, 3.8, but also the triple billion that is set out by WHO, we need to act now. And I think we will not be able, I not only think, we know we will not be able to achieve SDGs without including NCD to UHC, but it's also that we will not be able to be prepared for any new pandemic or any humanitarian crisis if we do the same. So no UHC without NCD, no preparedness and health security without NCD into UHC. Today gives me hope, and I know we will hear a lot of hope today, and I want to focus on that. We are forging new partnerships and new collaborations. So thank you for what has already been provided by UNITAR and Defeat NCD, but I have also many other friends in the panel. So Helmsley is one, we see World Bank in the room, I'm sure we have governments which is now stepping up. The need for action is really also set out by the World Health Assembly. So there is an implementation roadmap. We need more data. We need to act on the data. We need to prioritize. And I think what you are doing now in the Gambia and other countries, really living the fact that we need a national plan. It needs to be budgeted. It needs to be financed. It needs to go into the UHC. That is the way forward. So access to medicines. Dr. Tedros already mentioned the innovation that is in front of us here. And this is one very good example. And that is the recently established NCD Partnership Essential Supplies and Distribution Facility, which aims to improve the availability and affordability of NCDs medicines. This is an important basis, also basing on the WHO model list of essential medicines, and we need to do this together. Last, research and innovation. I'm extremely proud that we now for the first time have a technical advisory group for research and innovation, which focuses on low-level, accessible, also capacity-built workforce that can actually do implementation research as we implement our innovations. So we look forward to the awards, and this year is the year of commitment in action. So I want to emphasize, it was a true pleasure to see the first heads of state gathering during UNGA this year. We will have the second next year. We will have the third, we will have the fourth, we will continue. And it's extremely important that we have this highest level political action. That is not enough. What we have seen is the need for research, for innovation, and I'm extremely excited about this panel and this possibility. Thank you very much.
Dr. Mikkelsen, thank you. Thank you so much. And I'm now going to hand the floor to Mr. Mukul Bowler, who you met earlier. He is, of course, the Chief Executive Officer at the Defeat NCD Partnership, United Nations Institute for Training and Research. Before you take my hotspot, you have 5 minutes, and I will remind you when you are 3 minutes into your presentation. The floor is now yours. Mukul Bowler, please. Pleasure.
Thank you, Juliet. This year, our session focuses on action, measurable impact, and practical examples, such as those that Bente has described. There's an increasing amount of guidance available to countries today in terms of best practices and knowledge products. Policy implementation and advocacy on NCD action has also increased incrementally over the years. And of course, this is the result of years of work, research, and community efforts. This enabling environment has actually helped the Defeat NCD Partnership in its work with the provision of practical support daily to countries co-located inside ministries of health in the NCD departments, and in helping them move forward on putting together and implementing these costed action plans in Rwanda, in Myanmar, in Gambia, and now in 3 states in India, to tackle NCDs and progress towards achieving Sustainable Development Goal Target 3.4. Specifically, the example in Gambia last year at World Health Summit, the minister himself of Gambia was speaking at our session and explained how the partnership has been helping his ministry in bringing together 22 government institutions, together with civil society organizations, WHO, the private sector, to prepare a fit-for-purpose, inclusive, and realistically achievable action plan for the Gambia to raise resources against it and to assist in its implementation. So it just doesn't remain a nice document which rests on a shelf, but actually we accompany jointly with WHO, the private sector, with our development partners, philanthropic organizations in the journey to resource it, both domestically and internationally, and also in the implementation work that's very important. The outcome has been a very well-received strategy, which was launched on the 6th of July this year by the president of Gambia, along with his full cabinet, WHO, of course, and some major policy reforms have been presented during the launch, which will stimulate government's own provision of funds to implement this plan. The World Health Organization, Gambian Revenue Authority, other parts of government, permanent missions, donors, and implementing partners have all been present in engagement of this plan, in implementing its activities and fundraising. And our team has been supporting WHO in sharing data and helping WHO's work to implement using the same costing methodology to finalize the overall country national health strategic plan. So I'm very proud of that country level collaboration that we're doing with WHO, in addition to the brilliant work we do, at the global level. Now, that's all important and helps in building strong health systems. But how do we reach people who need the medicines and supplies on a daily basis to manage the disease and ensure that they do not get complications and help them lead healthier lives? In developing countries, NCD patients and their families have to make trade-offs on a daily basis. Thank you, Juliet. Their income is not increasing, and probably its value is decreasing with the current economic turmoil. Their purchasing power is not increasing. Their ability to sustain income and jobs while coping with an NCD is reducing. So how can we, in addition to improving policy, improve accessibility, improve quality? How can we provide the tangible support to these people so that choosing to get their treatment and care is easier? How can we reduce the risk of treatment where people are scared about it or its quality? And how can we ensure their access to care without directly or indirectly harming their own financial security? This is why we've established the Essential NCD Supplies Facility that Dr. Tedros and Bente mentioned earlier. We want to look at the daily needs of people. What does it take for them to make the decision to go for screening or not? How can we make that decision easier? How are the needs of a type 1 diabetes patient living in an IDP camp different from those of a patient living in a remote rural area, a desert, or an urban city, in India, in Gambia, in Qatar, elsewhere? How can we make our response more agile to people's needs? Expanding this further, how can we make sure that the only pharmacist, who's often the main source of awareness, prevention, and care for a remote village, doesn't go out of business with heavy burden of markups in a long supply chain with many intermediaries and small volumes of demand and procurement that don't permit the leverage for price reduction? Essentially, in summary, the functions of the NCD Supplies Facility we're building is about generating reliable forecasts for demand for drugs and diagnostics, catalyzing standard treatment regimens, mobilizing financing for drug procurement, procuring drugs via transparent competitive bidding using pooled procurement, and pre-qualified quality manufacturers. I'm very pleased to see Boehringer Ingelheim here today on the panel. We can't do this without the private sector. We need a whole system approach if we're going to make a realistic dent into tackling NCDs. So with that, thank you very much. I'm very pleased to see a full house today. And thank you to the panelists.
Thank you. Thank you. Okay, thank you so much for that, Mr. Makul Bowler. So what we've learned in our time together so far is the value of collaborative partnerships in combating NCDs and, of course, the role of the Defeat NCD Partnership Essential Supplies Facility. But moving on from that, a much bigger question: how do public health agencies like the Ministry of Public Health in Qatar prevent and indeed control NCDs nationally whilst contributing to the global health scene? Could you please welcome our next speaker, His Excellency Dr. Mohammed Hamad Al-Thami, who is Director of Public Health at the Minister of Public Health for the Government of the State of Qatar. Doctor, it's very good to see you. The floor is yours and you have 5 minutes. I will, of course, inform you when you are 3 minutes into your presentation. Thank you.
Okay. Thank you, Foster. Thank you so much. I'm so pleased to be with you here, and I'm proud of what the Defeat NCD partnership has achieved on the last few years, especially part of it was during COVID. So we're very glad that with the very urgent, important thing of COVID, we didn't stop these other important things and vital like NCDs. So we're glad that we are here in World Health Summit and moving forward. This is something positive. So I would like to speak about, from my side, to different points, the importance of this, and then locally what we did in Qatar, then internationally how the innovation and the future will be looking for. So as the importance, as you can see, NCD is, you should recognize it very well. It's not acceptable anymore to say it's not a priority. We know that 6 million people died from COVID and maybe 20 million were protected from death through vaccination and decisions that was made during COVID. But we know very well that 39 million will die from NCDs, and this will keep going on the long term. And we can do something for that. In Qatar, most of the cases that died from COVID under 60, most of them were having hypertension or diabetes or both. So it's clear that if we could protect more NCDs, we can protect even more deaths from COVID. This is as the importance that we are seeing here, watching, and we need to keep going because it's crippling countries. This challenge is going to grow and become a healthy part of the world, and we need to support these countries. Regarding locally, in Qatar, we didn't want to go internationally before we start fixing our home before we go forward. So in Qatar, we recognize the problem of NCDs through a stepwise survey that we did with WHO, and recognize that in Qatar we have high obesity and hypertension and mainly diabetes. So we take decisions because we are having the World Cup 22, and we start to change the system forever. And this is the healthy thing about sometimes big events that make you focus and get to your best. So after this decision in the last 12 years, we work on the capacity and how to improve our awareness in the system, and we ended by we having now all our hospitals are accredited by GCI, and at the same time all our primary healthcare is accredited from Canadian board Diamond, and we are the first country in the world to get the accreditation of Public Health American Board outside America, which make all the systems all accredited, and this is the first thing in a World Cup to happen before a World Cup. And all these things, we are building our home to increase our support internationally, but to go internationally, first prove that you are doing it right to move. Through these years, this decade, we learned a lot of things, and we can speak, but we need to take actions too. It's not only to be an art to speak, it's an art even to do an actions. And this will not happen with through partnerships and synergism between different partners.
It's into your presentation.
Yes, thank you. So by this one, as we can know, Qatar internationally is keen to be part of the world and add value internationally. As you can see here, for this one, Qatar has been working with 78 countries, supporting many countries and trying to focus, take responsibility for SDGs on these countries. We are aligned with SDGs of United Nations, and we are aligned with saving 3 billion through WHO vision and Dr. Tedros himself. We are hoping by this Qatar is a hub. We can go to more than 250 destinations from Qatar. We're hoping that we are proud that working with the Defeat NCD to have an office with another United Nations office in our new city, Lusail, and we are hoping this relation to have a chance to support these countries and to close the gap that's happening for NCD that was delayed even more during COVID. This relation Qatar has been working on this. We have Qatar Fund working with WHO. And we are hoping that many countries in the world and different sectors in the world should be responsible for many countries around them in the area and find for them a better ways to get the efficiency of NCDs. Many countries from public and private are worried that NCDs will take a lot of their cost, but this is an investment for the future for a healthy world. We are hoping through this relation and partnership to find more innovative ways and to prove to the world that we are making more efficient and effective ways that it's worthy to invest in. I remember the time we are proud of polio. We are proud eradication of polio, elimination of measles, controlling hepatitis C in high countries, endemic areas, and we are proud of HIV and UN/AIDS that go on. We are hoping through this one here now with another step. We are getting great steps through the years going forward and NCDs, and we are hoping with your wisdom and the balanced decisions, we are hoping to get to a great era in the future. Thank you so much.
Excellent, Dr. Mohammed Hamad Al Thani. Thank you so much. We will be returning to you later as well, because we do have some questions specifically set aside for our panelists. But what I would like to do now is to turn to Dr. Mansukh Mandavia. Now, he is the Minister for Health and Family Welfare for the Government of India. Unfortunately, he cannot be with us, but he has recorded this message for this event.
Namaste. Thank Juliet and fellow panelists for their contributions. Thank the Defeat NCD Partnership for organizing this session and for inviting India to be part of this panel and participating digitally. I personally related to the title of this session. I believe that in India, we have shown by example how words and commitments are translated in action and how strong leadership and partnerships can actually make that a reality. India has, over the last decade, transformed its presence on the global health scene and positioned itself to be the major producer of more medicines globally, especially for non-communicable disease, supplies and medicines. This is a true example showing how building the right infrastructure, capacities and structures in place helped us face a devastating situations during the COVID-19 pandemic, ramping up our production of supplies and vaccine nationally and responding to high COVID-19 morbidity and mortality rates, which were rapidly escalating to a national crisis. To ensure that our experience in India and that our huge production capacities are serving the global good, India can serve as the true pharmacy of the world. India is working closely with the Defeat NCD partnership. We have signed a partnership agreement with UNITAR that serves the various states in India to scale up their response to NCDs, but also bring India's expertise to other developing countries and ensure their continued access to quality assured, affordable NCD medicine and supplies through the essential NCD suppliers facility. Our national health policy envisages the attainment of the highest possible level of health and well-being for all through a preventive and promotive healthcare orientation in all developmental policies and universal access to good quality healthcare services. In India, National NCD program is being implemented for strengthening infrastructure, human resource development, diagnosis and management of NCDs. Facilities for tertiary care for NCDs are also being strengthened. In India, Ayushman Bharat is an attempt to move from sectoral and segmented approach of health services delivery to a comprehensive need-based healthcare service. Health and wellness centers are established where population level intervention has been implemented for 12 essential health packages including common NCDs. Under Pradhan Mantri Jan Arogya Yojana, we are providing health insurance coverage for secondary and tertiary care hospitalization to poor and vulnerable families. Our course, capacity building nationally and internationally, must be a priority to empower community and local authorities to avoid the devastating impact that epidemics, pandemics, and other emergencies can impose not only on the health system but further on the economic and social systems. We firmly believe that health promotion and prevention, including lifestyle modifications, are critical to addressing the challenge of increasing burden of NCDs. Awareness for prevention and control NCDs as well as healthy lifestyle being carried out in mission mode at all levels of health deliveries. We also recognize the need for involvement and active engagement of other non-health sectors in implementation of preventive intervention, where India has developed a national multi-sectoral action plan to guide multi-sectoral efforts involving other ministries, departments. I would like to highlight that in India, we are encouraging young researchers to carry out research and act as catalysts for institutional change, which facilitates the development of and demand for locally generated research to address context-specific problems and propose action-oriented solutions. This in turn helps to effective policy and program implementation. For implementing our newly established National Vaccination Program for HPV vaccine in India, our drugs controller has given approval recently to Surveyvac, which is India's first HPV vaccine. Hopefully, it would be affordable and accessible to our prepubertal girls 9 to 14 age group. It is indeed a most appropriate time for actions to fight NCDs together and bring health and wellness. India assures that it is committed to the cause of prevention and control of NCDs. Thank you. Namaste. Thank Juliet and fellow panelists for their contributions. Thank the Defeat NCD Partnership for organizing this session and for inviting India to be part of this panel and participating digitally. I personally related to the title of this session. I believe that in India, we have shown by example
We've had to leave it there, but you know what? A very powerful message. And Dr. Mansoor Mandavia, even though you can't see me, namaste, on behalf of myself and of course on behalf of all of you. But look, an excellent message, and please applaud. It's a very powerful message as well, because what it does is that it demonstrates the power of collaboration and also how capacity develops sustainable health projects that can produce positive outcomes, effectively setting the bar for others to follow. But at the end of the day, when you strip back these things and go to the basics, innovation and entrepreneurs are also key. And this is why I would like to hand the floor to Karine Bouillon. Have I pronounced that correctly?
Perfectly.
Oh, excellent. I don't even speak French. Now, she is the head of the Human Pharma Business Unit at Boehringer Ingelheim. And what she's going to do is to explain how the company's drug pipeline supplies vital NCD treatments to sustainable health projects, as we heard from India. So Karine Bouillon, I'm feeling very good now. You have 5 minutes with your presentation, and naturally I will tell you when you are 3 minutes into that, but the floor is now yours.
Thank you, Juliet, and good afternoon to all of you. It's such a pleasure to be here and exchange ideas on how to tackle some of those health challenges that we face that are, well, staggering numbers. We all heard those numbers. We heard how also collaboration is so key. And now I would like also to show how innovation and rapid integration of innovation into the healthcare system can also help and is part of the solution, because collaboration and innovation work hand in hand. So with our corporate sustainability program and framework, Sustainable Development for Generations, we are committed to expand access to healthcare for 50 million people in vulnerable communities around the world by 2030, while at the same time investing 35 billion euros in developing innovative health solutions and hopefully tackle NCDs with them. For that, we are of course, applying our deep expertise, but also collaborating with others. Here are some examples. Angels. This is a worldwide initiative that optimizes the quality of stroke care, serving more than 10 million patients in over 7,500 stroke-ready hospitals. Another example is Pathways, and this is a collaboration with Indigenous health policy leaders in Canada. It is led and informed by the Indigenous community, and the goal is really to close the health gap for more than 20,000 people to start with type 2 diabetes and COPD. We also have new access to healthcare initiatives in Kenya that will support screening and diagnosis for cardiovascular disease and provide access to much needed medicines in type 2 diabetes and hypertension. And we look forward to expanding to other countries. I'm also very proud of the work we are doing through our health through collaboration approach. And Mukul, I share your passion around the progress made with the NCD partnership. We have been a contributing member to this partnership since 2019. And we also already see those concrete results, especially in our case in Gambia, Ecuador, and Rwanda. And I'm really happy and pleased to announce that we will be extending that partnership for another 3 years and hopefully in more countries. Our partnership with Ashoka, the largest global network of social entrepreneurs, started in 2010. Our program, Making More Health, was originated from this partnership. This supports innovative social entrepreneurs working with and in vulnerable communities. So far, we have supported 120 entrepreneurs, engaged 20,000 of our employees, and impacted the lives of over 12 million people. Our Business Accelerator program, which supports social entrepreneurs in sub-Saharan Africa, takes a holistic approach to NCD management across the continuum of care. We provide financial means, technical expertise, and management skills to scale up and help sustain their business models. We, of course, also work with community health workers to train them on lifestyle management for NCD prevention. So in a nutshell, science and technology cannot solve all the challenge on its own around NCDs. It is collaboration between businesses, researchers, regulators, policymakers, payers, decision makers, you name it, all of us in this room, that we can make a real impact on health systems and people. After all, we all want the same thing. Together, we can fulfill the aim to deliver a better health for all. And our purpose to benefit every person in need, regardless of where they were born or live, transforming lives for generations to come. Thank you very much.
Thank you very much. That was Karine Bouillon from Boehringer Ingelheim. Now, again, another recap, because we've heard from public and private sector donors. What I want to do now is to move the presentations towards the area of philanthropy. A question: why does the essential NCD supplies facility matter to philanthropists, and how does it complement their own objectives? Well, Dr. Gina Agustradu is the Program Director for Type 1 Diabetes and New York City Programs at the Leona M. and Harry B. Helmsley Charitable Trust, a question which you are going to answer. The floor is now yours. Do I need to say that you have 5 minutes and that I'm going to tell you when you're 3 minutes into your presentation? Fantastic. The floor is now yours.
Thank you, Juliette. Good afternoon, everyone, and thank you, Juliet, for the introduction. I'm so happy to be here in support of the Defeat NCDs partnership event. At Helmsley, when we're looking at new investments, I like to start by picturing the people on the receiving end of these programs. I think about the mother I once met in Malawi, whose daughter was diagnosed with type 1 diabetes. For months, she watched her daughter struggle with headaches and stomach aches. She had watched her fighting an invisible enemy. As a mother myself, I know how scary that must be have been. When they learned that her daughter had that type 1 diabetes, they were relieved because they knew what they were fighting, and they knew that there were tools that they can help with this fight. Then the doctors prescribed insulin. She learned that having insulin, giving insulin to her daughter, not only will keep her alive, but she will be able to go back to school, to play with her friends, and to realize her dream one day that she will become a nurse. The doctors also explained that she has to test her blood glucose 5 times a day, every day, for the rest of her life. And that is when the reality set in. She realized that unlike malaria, type 1 diabetes, it's a lifelong disease. It needs a lifelong management. At the time, insulin was almost impossible to find in rural Malawi. High prices and supply chains markups, a single dose of insulin might cost as much as a day's worth of food for her entire family. And that was only for insulin. What about the other supplies? How she could afford that? For the mother in Malawi, the essential supplies facility could have made the difference for her life, for her child's life or death. From Helmsley's perspective, we are excited that this model can not only ensure life-saving insulin, can also provide so many other medicines for life-threatening NCDs. In global health, partnerships are absolutely critical for making a sustainable impact. The facility promises to break down the silos with a single procurement system rather than a patchwork of supply chains. And at Helmsley, we look for investments that strengthen systems that improve the lives of people in communities and in countries. And this facility approach has the potential to transform the ecosystem of care for everyone living with NCDs. So I want to congratulate the Defeat NCDs team on this work. Helmsley has been a proud support from the beginning. We hope that model will inspire procurement partnerships around the world. But while we're here together, I want to say that manufacturing, production, and distribution of medicine is just one part of the equation. We have also to think and we have to support ministries of health to help them forecast demand for these supplies and integrate them into national standards for NCD care. But most importantly, we must continue elevating the voices of people with type 1 diabetes and other NCDs, because they are the experts that they can talk about the need and the situation on the ground. The global health community has to share one vision and work towards a future that bridges the public sector, the private sector, and the civil society for sustainable growth change. The Helmsley Trust is committed to this vision. We cannot do this alone, though. We need partners to ensure bright, healthy futures for all the mothers and daughters who rely on these life-saving products. There is room at the table. Please join us.
Thank you so much, Dr. Adestradu. I have a suspicion your call will be heeded before the session is over. Now, much of the work that's taking place in the NCD space is actually in response to challenges that are happening right now. And we actually heard the difference that it makes, obviously, from Dr. Agustrado's experience in Malawi and indeed many others in different corners of the world. But that is the present. What about the future? The loss of 41 million lives each year to non-communicable diseases is an avoidable tragedy. This is something on which we can all agree. Researchers and entrepreneurs who are looking to reverse that number are developing unique and innovative solutions with the potential to make a genuine difference. Now, their determination is among the weapons that will change the future. And this is why I'm delighted to hand the floor to somebody who is part of that future, Anushka Halder. She's representing her peer youth researchers who will be awarded implementation research grants today. So congratulations to you. Anushka is a social anthropologist at New York University. Welcome to the panel. You have 5 minutes. I will tell you when you are 3 minutes into your presentation. So please, the floor is yours.
Good afternoon, everyone. I'm honored to be here. We have an immense vault of scientific knowledge that we can harness to address the multiple public health crises before us. And yet, somehow, we are not there yet. There is a considerable gap between what we know needs to be done, what we can do, and what we have achieved. This is where implementation science steps in. Implementation science is the science of translating research findings into routine practice. Employing both qualitative and quantitative methods, it explores how we might speed up the process of implementation. It focuses on whether and how an intervention will be adopted and whether it will be sustained in real-world settings. This is a fledgling field, and I believe it would benefit from intergenerational perspectives. Younger people tend to be largely absent from policy decisions in global health. Funding, such as the joint WHO-UNITAR incentive grants program for young researchers to scale up implementation research capacity on NCD and mental health in low and middle-income countries, for achieving SDG 3.4 gives young researchers, us, the much needed resources to push the envelope. I would like to take this opportunity to illustrate how. The incidence of diabetes mellitus, or DM, among tuberculosis patients is notably higher in the general population at 15.3%. Patients with DM face threefold higher odds of progression from latent TB to active infection, and 5 times the risk of death. And yet, patients with well-managed DM have TB treatment outcomes which are similar to the general population. There is therefore a pressing need for improved capacity for DM care in the context of TB treatment. The Uganda Tuberculosis Implementation Research Consortium has been working towards closing gaps in TB care in Uganda for over a decade. Their prior research identified gaps in patient and health worker communication in DM and TB units in Uganda. These gaps result in a misunderstanding of the disease and reduce the likelihood of linking to DM care. There is also a persistent stigma associated with TB. Our overarching goal is to use methods from implementation science to address gaps in this care by designing a cost-effective intervention to facilitate linkage to DM care during and after treatment for pulmonary TB. Using multi-stakeholder insights from an ongoing study of TB patients with DM in Uganda, we co-designed the diabetes informational pillbox with our team of Ugandan nurses, physicians, clinician researchers, and academic researchers at the Dr. Armstrong Huff Lab at New York University. It's an informational notebook with a pocket to safely store medicine. On one side, this pilot prototype has narrative-based graphical information about DM and its functional and its relationship to TB. On the other is a pocket to safely store TB medication. Thus, while patients can use the PIST box to store their medication, they will also have access to DM information catered specifically to them. We are using participatory prototyping, an iterative approach to intervention optimization that is rooted in implementation science principles to garner key stakeholder feedback about its usability. This intervention is a result of collaboration between young researchers like myself, patients, providers, and a diverse intergenerational international research team. This is just one of the 8 examples in this room of what is possible when new ideas are buttressed by established expertise, of what is possible with intergenerational participation in implementation science, when young researchers have the opportunity to contribute to the future of NCD management. Thank you very much for your time.
Anushka, thank you so much for that presentation. I'm going to reserve most of the applause for a little bit later. But look, I'd also like to extend my gratitude to all of the panelists for their excellent contributions and also giving us some personal examples of how their approach is making a difference in the fight against NCDs. Now, there are some very specific questions that I'd like to put to all of you over the next 15 minutes. And can I stress as well that your answers should be no more than 2 minutes, but you're all doing very well because so far you've kept to time. So Dr. Mickelson, it's rather fitting that you kicked off the session, the first session. So now you're going to begin this bit. But look, we've seen how the Defeat NCD Partnership has actually been providing support to the Ministry of Health in Gambia in developing their national NCD strategy. Also as well, the World Health Organization, they've been involved in this with their active participation. So my question to you is, what do you think that other countries can learn from these collaborations? Here I'm referencing a 3-point collaboration between the Defeat NCD, the government in Gambia, and the World Health Organization. And do you see it as a template for scaling up capacity for providing good, solid NCD services? You have 2 minutes.
Thank you very much. So first of all, I think we have heard sign of hope today, both through the partnership, but also other things. And I would like to comment that, you know, it's not about spending, Juliet, it's about investment. You used the word spending. I think it's about investment. And this is also what we see. And I just want to also comment that, you know, and I was very compelled by Gina's example. And this is why we also at WHO have started the Global Diabetes Compact, because I think you need to remember when you walk out here that it's 100 years since the discovery of insulin and only 50% of the world's population get it. So that's coming back to why initiatives like Mukul and his team is leading is important. So I mentioned diabetes. I will also go back to Qatar because you probably don't know that 32% of all global deaths is linked to hypertension. And it's one of the most growing diseases. Only 50% know that they have the disease. Only 40% is under some kind of treatment. And lack of access to medicines is actually one of the big blockage. And only 20% is actually under control. So I think what we heard today, you know, partnerships and or partner and also with the private sector. So I would like to let you know that we are very welcome to continue also with your company, because we have private sector dialogues where we try to get commitments to the asks. And this has happened now also with the UNITAR engagement. You have been there from the start, and I think this is the right way to go. We need to develop the ask on the basis of what people living with the diseases are telling us. It's about medicines, devices, and healthcare providers. And then we need to, on the basis of this ask, develop further, as we have seen in the countries you mentioned. So I think that is my comment. I'm so very pleased to listen to a youth voice. And for me, youth is not a kind of an iconizing thing. It is the leaders of the future. So I love your intervention when you say that innovation is not only about innovation, it's actually a call to action. So when we discover insulin, how can it be 100 years after that we couldn't actually provide insulin to everyone, which actually was Professor Banting's request when he did that with colleagues 100 years ago. So I think I will stop there. Thank you.
Thank you so much. Please go for it.
Actually, 2 people, Bente and Antonio, who actually insisted that we have to have, and when we were conceptualizing this panel, they said that we have to have at the center the youth researchers. So thank you to both Antonio and to Bente really for sort of words into action. Yes.
Thank you for that, Nicole. So I know that we will be hearing from you a little bit later on, but Bente, in your answer, you referenced there the work of Qatar, and I'd like to move to you, Excellency Mohammed Hamad Al Thani. Now, nobody needs to be reminded that this year, Qatar is hosting the FIFA World Cup, and I'm sure that apart from the event itself, you're going to be using this to really highlight the work that you are doing to defeat NCDs. But are you concerned that perhaps the message of what it is that you're trying to achieve could perhaps be lost in the euphoria of the event, the World Cup?
Yes, thank you for this exciting question on time, and welcome all to Qatar, hopefully next month. And I hope to have a very exceptional World Cup. Yes, thank you. So yes, we through the World Cup, we are proud that with the support of WHO and FIFA together, they met together for a legacy of 3 years, 1 year before and 2 years after the World Cup in Qatar, to connect sport with health. And this is some practice that maybe we initiated, but I hope that this keeps starting in any mass gathering event for health, that every country, when they are happy that they will entertain the world, they should make the world wiser and more balanced and live a better life. So through this sport 3 years event, we are having many actions that are happening. As you know, Qatar is one of the rare countries in the world that all the cities are approved from WHO as healthy cities. And this may not happen to be more excited with the connection between sport and health. We have now enough parks in every city to work people and practice. We insisted to have taxes on tobacco and on energy drinks and all sugary drinks, and stop electronic cigarettes in Qatar. Is to be awareing people about these risky things as practice. We work hard with FIFA, and they accepted to have more healthy food during the World Cup, and to recognize in the coming years, it's not only any food company can come and get the FIFA, they should recognize a healthy food options in these companies. Is aware about the physical activity. There will be many. It will be, of course, the tobacco-free. Okay, tobacco-free sport event, and we are hoping that will be many panels and raising awareness about health, and we keep as we start this and keep going for the next decades. Thank you.
Thank you very much, and good luck to Qatar as the host of the World Cup. It would be a bit churlish of me to ask you how far you think they'll get, because it might provoke controversy amongst the audience, but thank you so much. I'm sure they'll do very, very well. But let's move on now, because I want to put the spotlight on Karine Bouillon of Boehringer Ingelheim. Of course, she's head of Human Pharma Business Unit. Now, you know, you were talking there about, in your earlier presentation, about social entrepreneurs and how you co-create with social entrepreneurs via the Making More Health Business Accelerator. What I'd like you to do is to tell me in 2 minutes how it works and how a social entrepreneur can be part of that initiative. There are social entrepreneurs out here. How can they actually connect with you? You have 2 minutes, Karine.
Yes. So the first thing is to apply. And then there is a selection process that lasts around 4 months, where there are due diligence, we meet, etc. And the social entrepreneurs that are selected then come to what we call a kickoff workshop, where they will meet some of our teams and prepare for a pitch for a pilot. And then they have about 2 months to prepare for that pitch. And the winners will then get 50,000 euros to go into implementation of the pilot, but that will also have the help of Boehringer Ingelheim's employees. And depending on what the needs are, it could be finance people, supply chain people, HR, scientists, etc., etc. But this is also to really execute the pilot, and then hopefully come to the scale up. And then after the pilot and the scale up pitch, the winners will then get 200,000 to go into that scale up phase, and hopefully come then to a sustainable business. So it's a whole process where we accompany the social entrepreneurs along that process with money, but essentially also with our expertise in many different modalities and domains based on our business experience. So that's how we help. We do have some documentation here, so if you are interested, don't hesitate to contact us. Thank you.
Okay, thank you so much, Karine, for that explanation of Making More Health Business Accelerator, how it actually works, this relationship with Boehringer Ingelheim and entrepreneurs. And I love the football analogies. I'm not sure if they were deliberate or whether they were accidental, but they were very impressive the way that you incorporated that into your response. Let me move on now to our next panelist, in fact, Dr. Gina Agastradou, because what I would like to put to you, in fact, is really the results of a study which was carried out by the British Medical Journal. Now, it found that 8.4 million people around the world suffer with type 1 diabetes. And by 2040, the forecast is that could rise to 17.4 million. Two things in this question. First, what is your reaction to that forecast? And is there a risk that the Helmsley Charitable Trust could actually fall behind rather than ahead of the curve in the diabetes strategy, despite your best efforts?
I would like to say about this increase, it almost doubles in a couple of decades. It's not only the increased number, the number increases, but the happy aspect of that is that with efforts like defeat NCDs and other efforts, more people will be diagnosed with type 1 diabetes. We know as of today, many children are dying even before they get diagnosed. So I'm hopeful that this number, this increase is not only because we see more cases. My concern as Helmsley Trust is actually that if a disease like type 1 diabetes with such a low prevalence is doubling in 2 decades, what about all the other NCDs that they are higher prevalence? My concern is, are our health systems strong enough to take care of all these people? Helmsley, I don't know if it's ahead of the curve or behind the curve. I know that I will do everything in our power to strengthen health systems, to support the universal health coverage, and to support efforts like the defeat NCDs and the essential supplies facility to ensure that every drug for NCDs is available to every corner, to every household that they need it.
Okay, thank you very much for that, Dr. Gina Agastradou. Thank you. And the final question to Anushka Halder. What I'd like to know from you is, what was it that made you decide to focus your research on integrating diabetes care into TB care? And also, do you sense that academics with a background that's similar to yours actually want to be part of this journey towards outcome excellence? Because that's why we're here. You're part of that future.
Thank you for that question. My answer for the first part of your question as to why I work to integrate diabetes care into established TB care is because we already have these systems in place. And it is to our benefit that we use these systems to encourage treatment for and care for other diseases. So that is my answer for your first part. And as to your second question, I think academics and researchers can play a huge role in moving forward in our fight against NCDs. But we can only do it in collaboration with other parties who are working towards it.
Okay, and you have these other parties here.
Yes.
Anushka Halder, thank you so much. And let's actually extend the applause to all of our panelists, because they really have been very comprehensive in the responses they've given to us. Even though I feel extremely guilty for putting them under severe time restraints, but I'm sure you all forgive me. Am I right in saying that? Thank you so much, because we do have a great deal which is happening in the time available. So panel, could I please ask you to return to your seats in the audience and please applaud them on the way, please. Thank you so much to all of you, and I'm sure that you will have the chance to meet them at the end of this session. Now, the Global Non-Communicable Disease Platform of the World Health Organization The Defeat NCD Partnership, in collaboration with the Alliance for Health Policy and Systems Research, have come together to award special grants to aid the research of students at master degree level. We have alluded to this. Now we're going to add some more detail to our outline. So for more on this initiative, could you please give a very warm welcome to Dr. Taya Collins. Taya is the lead global NCD platform of the World Health Organization. I now concede the floor to you. Taya. Thank you.
Good afternoon. I think we have a few slides, so just bear with me 1 second. But I guess while we're waiting for the slides to show, this is a really exciting time for all of us who participated in this program. And I'm really happy to tell the story of this program of young researchers, but I will be very brief. First of all, it's intuitive. We know that we need to invest in the future. But from the NCD perspective, we really understand that it's also important to have young researchers part of the process, so they also move forward the NCD agenda and we have happier and healthier communities all over the world. At the Global NCD platform, we definitely understand that. And in every activity, we're trying to engage young people, researchers, to give us their ideas and innovative solutions to the problems. So in our multi-stakeholder global dialogues or any other activities, we're trying to engage them. But we also realize that, yes, we know that countries are struggling. And from today's panel, we heard that there is still this gap from words to action. And who can really push words forward other than young researchers? So that's how this program came to be. And the program obviously is very ambitious. It's still the first steps, but we found the like-minded individuals, and thanks to Defeat NCD Partnership and Mukul in particular, it was 4 years ago in Oman when we had this conversation. It was a capacity building conference when we were interacting with researchers, with NCD managers, mental health managers, and they were all telling us that we need solutions that are very specific to our countries, because countries are different. They have different political economies. They have different culture, if nothing else. And how can we really design policies and programs that work? And so this is our solution, a very ambitious one. We designed a program together, and we also involved Alliance for Health Policy and Systems Research, but because they do have a lot of experience in research. And we thought, okay, we need to really find researchers who are coming from the countries where they can implement their own projects. And this will be a global project, and this will be a multi-partner project, and we will definitely have the impact in countries. So here we are, and the objectives are obviously to promote implementation science as the tool to translate global policies and commitments into country-level action. But also we want to promote investments because we can demonstrate the results, but also we want to build the capacity of young researchers, that we give them enough resources to continue their research work. And we know that in many countries, research is very underfunded, and the young researchers, they don't have the opportunities to continue their academic careers, and also to improve the research policy interface. And finally, of course, this should be a partnership endeavor. When we train young researchers, we give them the resources to go back to their countries and to engage in policy-making processes. We will definitely achieve the results. But all this wouldn't have been possible if we hadn't had the support of many, many individuals. And I will just name the few. First of all, the young youth, you've seen the Daria Berlina with you. I would like to thank her for her enormous commitment. And I'd like to thank Raya Al-Barjoud for her commitment and dedication from Defeat NCD Partnership. The committee, they were members of the committee as well. We had a technical expertise on our committee from WHO, from UNITAR, from the Alliance and external partners, and over 100 proposals have been received. And today we're here, but it was, again, a long journey. I wouldn't take you step by step, but you can see that it took us almost 2 years to get here. And here we are. But there is one special person I would like to thank. Without her support, that wouldn't have been possible. The director of the Global NCD platform, Dr. Svetlana Axelrod, who is a physician, pediatrician. She's also a researcher. So she always tries to make sure that where the young researchers, do we have somebody from academia? That's always the questions. And I'm delighted to give the floor to Dr. Axelrod to start the ceremony and to acknowledge the contribution of our young grantees. Thank you so much. And Svetlana, the floor is yours.
Thank you so much, Taya. Thank you for inviting us to this event. And it's a great pleasure, dear guests and colleagues, to be here and to start the sweetest part of our panel today to award. But as Taya said, it's a big partnership. And I am, as a director of the Global NCD platform, want to highlight that we have the very good partnership with UN agencies, with Defeat NCDs, and with others who are also participating in this World Health Summit. And it's really a good history, a good example of collaboration where we are engaged with our colleagues and we support the researchers, and the young researchers is the priority. As it was mentioned in the DG speech, we are really looking for the investment of the young people and their contribution of preventing the non-communicable diseases. And it is really a great collaboration and great honor, but I couldn't do it alone because I want to have my good friend Mukul with me to start the ceremony of presenting. May I ask you please to join me? So, we have to present the presents for our distinguished awardness. So, Anushka Halder, we want to invite you to get this certificate, and Anushka is from Uganda. So. I don't know how. Our next winner is Jessica Tanaka from Peru. Please. The next one is Yu Su. Am I correct? From China. The next is also from China, and this is Bolu Yang, and you will take this certificate on her behalf. Yes, she's your friend. And our next young researcher is from, it's not mentioned here, Anish Patia, India. You want to say a couple words?
Hello, everyone. Good afternoon to everyone. So I'm from India. I'm a PhD student, and I'm uh, so thankful to be here. I would like to thank Defeat NCD, WHO, as well as UNITA for giving me this opportunity to be here. I would like to thank my family and friends, and also my chief guide who was supportive during the whole process. So thank you very much.
Azep Tasema from Ethiopia.
Thank you so much. Thank you for this opportunity. I would like to thank all the WHO DFID Partnership Program coordinators, and I'm here representing just 100 or more young researchers who didn't get the chance to be here. As a young researcher, we all know that, especially the global health space, it's more or less overcrowded by male senior researchers who are mostly from yeah, that's my opinion and from my early observation. So having an opportunity like this, a great opportunity like this for a young researcher, a female young researcher from low resource country like Ethiopia, it's really an incredible opportunity. So I'm working on improving access to low resourced, hard to reach community in Ethiopia. And this work and other opportunity will helps me to work and strengthen in this space. Thank you so much. Thank you.
I would like to welcome Christian Kenny from Cameroon.
I would like to thank the Defeat NCDs partnership program. I would like to thank the WHO program too. And I would like to thank the RSD Institute in Cameroon, who was helping in promoting the young researchers. And I'm really grateful for this opportunity to be awarded of a grant to be working on I'm working on type 1 diabetes in children in Cameroon, and we know that it's one of the most neglected non-communicable disease. So I'm really grateful for this opportunity as a female young scientist and researcher. Thank you very much.
And I would like to invite Sarah Mustafa from Egypt to take the certificate.
And I would like to thank the WHO and the Defeat NCDs, of course. Thank you for giving us hope. I consider this award as a sign that I am on the right track and that research is the future and we can hopefully make a change one day. Thank you for giving us this opportunity and the invitation to have this amazing exposure to all these amazing people. Thank you again.
Thank you so much. The floor is yours.
Thank you very much.
Svetlana, I'm so happy to share the stage with her after 4 years. Svetlana was at the launch of the Defeat NCD partnership on the 24th of September 2018. Couldn't have done it without you. And thank you for the continued support at the General Assembly in New York. Sorry, Juliet.
Thank you, Juliet.
That's fine. I'm going to cede the floor in a few moments, but what I would like to do is to say congratulations to all of our award winners. Very powerful acceptance speeches. And if you really want to understand what this journey is all about, you saw it with that glimpse into the future, which is why I think they deserve more applause. They're going to have a fantastic future and they will make a difference. There is every reason for us now to be optimistic going into the future. We have a few minutes left, and I would now like to hand the floor to Dr. James Hospitalis. He is chair of the Executive Committee of the Defeat NCDs Partnership. He's now going to share some final thoughts and words. Dr. Hospitalis, the floor is yours.
Thank you, Juliet. Good afternoon, everyone. My name is James Hospitalis. I'm from Trinidad and Tobago. The Caribbean is the group of countries that took NCDs to the global level in 2012 with the high-level meeting on NCDs. I've known the Defeat NCD partnership from the beginning, and I have to confess, when I was first asked to chair it, Mukul might not like me to say this, but I actually didn't want to because I was so busy. But NCDs have been my passion since I was all of my professional career. And so I accepted. And what I have seen today, the focus on action in countries, the partners that are here, really gives hope that we can achieve what this partnership is set out to do, to tackle NCDs in low and middle income countries. There are other capable partners who form part of the ecosystem in this, WHO with its normative and policy roles, the NCD Alliance with its advocacy role, and Defeat NCD is focused on action in countries where it's needed. I was really happy to see the last bit on the young researchers. Now, I only saw one guy. What happened to the guys? Dude! Next time around, I hope the panel that was selecting wasn't weighted to only choose girls. But that's a joke, right? I'm sure it was a robust panel. But this problem, obviously, of NCDs, especially in low and middle income countries, the support that is received in development aid is way below the size of the problem. So it's good to see the partners that are assembled to focus on this. Let me close, because I'm very short, with 3 points about the future. One phrase that has not been mentioned in this room today is the threat of climate change that hangs over our world. Why is that significant to NCDs? Because the global heating, the floods like we've just seen in Pakistan and New York and lots of other places, the storms like we have in the Caribbean that smash everything, the sea level rises, these things, people with NCDs are particularly vulnerable. And so I encourage the Defeat NCD partnership to take consideration of that change in its planning, is pillar one in thinking of how you innovatively deliver services, in thinking of the essential medicine supply. We've seen in the Caribbean where after a big storm, excess mortality, mostly due to NCDs, goes up for months afterwards. And that's because people can't get their insulin, they can't get their renal dialysis, they can't get a whole lot of other things that they need access to. So how to cater for that in future is the first challenge. The second is we need the partnership to grow, to address the existing problem and to deal with the superimposed challenge of things like climate, like biodiversity loss, like pollution. We need more partners to join it. And I encourage those who may be listening to think of that. And then the very last thing I'd like to say going forward is to thank and recognize the CEO and the staff of the Defeat NCD partnership. They've been doing a great job. And so much work is ahead of them. They're going to need to go to the gym regularly and keep well fit and exercised to be able to tackle the challenge in front of them. Thank you very much. Good afternoon, everyone.